Okay, we are all set.
Okay, great. Welcome everyone to the Water Program Team Monthly Water Meeting. Today we are delighted to welcome Maura Allaire. She is an assistant professor at UC Irvine. She's an expert in water economics and spatial statistics, and she uses this in her research to assess water resource management issues and equity in drinking water quality. She has a PhD from the University of North Carolina and did a postdoc at Columbia's Earth Institute and is now running the Water Equity Lab at UC Irvine. So thank you so much, Maura, for joining us. We're going to go till 4 p.m. And so maybe if you could leave some time at the end for questions and we can do Q&A after your presentation.
Great. Thanks so much. Yeah, and thanks so much to Ellen and Safiq for putting together this regular monthly seminar series. And yeah, let's see, I will start sharing my screen so we can get started. And yes, as Ellen mentioned, I'm very much interested in using methods of environmental economics as well as spatial statistics to better understand water equity and really understanding those disparities in infrastructure services and how governance and policies at multiple levels, local, state, and federal, can improve water security. The study I'll share with you today touches on the challenge of securing safe drinking water for communities. And this is joint work done with Sarah Acquah, who's a former postdoc at UC Irvine at our Water Equity Lab. And to start off, I'll sort of cover ground, past research that we've already wrapped up, and then this more recent study on water equity in California. So in past work, I've looked at the regions and types of communities that might benefit from targeted assistance. And the good news from this past work is that the US has some of the best water quality in the world, and the vast majority of water systems do deliver safe drinking water. But each year, the problem is that about 7 or 8% of water utilities fall behind and don't meet national health-based standards. And this map shows that for each county, the number of health-based violations per water system that occurred from 2004 to 2015. And you'll notice that there are some hotspots, especially in the Central Plains, Oklahoma, parts of Texas, to a lesser extent, the Central Valley. And where violations are concentrated, these are locations where some water systems have repeat violations, reoccurring issues that happen year after year that don't get resolved, and potentially expose communities to elevated levels of contamination. And this is especially the case in Oklahoma, which has the highest prevalence of repeated violations, mostly for a type of contaminant called disinfection byproducts. Now, from this past work, also we looked at what types of communities have the highest prevalence of violations. And this graph is pretty much going in order of more density to less density. So looking at how violation prevalence differs across population density. And you'll notice that urban areas have less prevalent violations, followed by suburban areas. And then the brunt of the burden is being felt by rural communities. And then if you break these rural communities further into those of lower income and higher income, just based on where they fall, according to median household income at the national level, there's a further difference between rural communities that have high income above national median household income and those that fall below. And this compliance gap especially grew after the early 2000s. And this happens to occur at the same time that new water regulations took effect that were related to that class of contaminants called disinfection byproducts. And so the key takeaways from this past work are that some communities might not have the capacity, the technical, managerial, financial capacity to comply. And so this means that some communities might face recurring issues year after year that don't get fixed because they simply lack the ability to comply. And so we know that violations extend well beyond Flint, and some communities might be more vulnerable than others. And this takes us then to current work that has a more California focus. So work that I more recently wrapped up and is currently under review, it takes a deeper look at inequities across communities, especially in terms of income and race, and what's happening in terms of compliance. And surprisingly, there's actually few studies out there that address disparities in drinking water quality. Most past environmental equity work looks at industrial emissions to air or to waterways, so more addressing Clean Water Act issues as opposed to Safe Drinking Water Act issues, the water quality that's coming out of people's tap. And I was able to do this by developing demographic information at the water system level for over 1,700 water systems across the state of California. And so by doing this, I was able to assess inequities across the state during the past 20 years. Previous research that's geared towards drinking water tends to be limited to analysis of differences in environmental quality across demographics, mostly at the county level when it comes to drinking water quality. So this is aggregate information far above the level of an individual water system. And so by using coarse county level demographics, we're not exactly getting at the inequities that exist at the water system level. And by using aggregated data, such studies are taking what would be called a unit hazard approach. And this is making a really big assumption that within a given geographic area, oftentimes it's the county, that members of various demographic groups are equally exposed to impaired water. And while this assumption might hold for certain contaminants that are uniformly mixing, this certainly isn't the case for drinking water, which is delivered to very specific service areas through pipe networks. So drinking water is not a uniformly mixing pollutant, and within a county, there's considerable variation in terms of demographics and also in terms of exposure to water contaminants. And this is the data gap not only for researchers, but it's also a data gap for regulators. Regulatory assessment of drinking water disparities, these aren't actually routinely done, since demographics, again, they're not collected at the level of an individual water utility. And this is a huge issue, right? Drinking water currently isn't included in EPA's major tool for assessing environmental justice, which is EJ screen. And again, it's simply a data availability issue. But this could be done, right? I've developed these data for California, and these data could be developed for larger regions and even nationally, especially for water systems that already have mapped service area boundaries that have been digitized. This is straightforward. And in the study I'll present today, I'll present an approach for exactly doing this. Another way that equity considerations are not factored into EPA regulatory analysis is that, to a certain extent, EPA does try to consider equity in terms of income and the ability of water systems to afford new drinking water quality regulations. By and large, these assessments are geared towards assessment of scale factors and how small systems might face a higher burden in terms of complying with new regulations versus larger systems. And income to some extent is looked at. Typically, what's done in terms of affordability analysis for new regulations is that the EPA considers whether new regulations will raise customer water bills, the average customer water bill, to something that would be above 2.5% of national median household income. Now, notice that I emphasized national income levels. The income level of a specific water utility isn't being considered. And so given that there's massive differences across communities in terms of customer income levels, there's sort of an incomplete consideration of equity currently when it comes to regulatory assessment. And so if we're not going to account for customer income within individual systems, we really don't know whether regulations are currently affordable for particular water systems. And these unacknowledged regulatory burdens might fall especially on water systems that serve larger portions of low-income households. So that's sort of the broad overview. And then to dive into the specifics, to overcome this data gap and what was done in this study, well, what was done in this study was that I created a panel data set that examines disparities at the water system level. And to do this, what we did was we constructed a data set of water service area demographics for individual systems. And this includes over 1,700 water systems across 19 years. And the water systems included in this study serve over 99% of California's population that's served by community water systems. And the study assesses how demographics are associated with water quality violations for all 91 contaminants that are currently regulated by the Safe Drinking Water Act. And so how is this, unique data set on water system level demographics developed? Well, I really relied on aerial interpolation here. I combined information on service area boundaries of the water systems with socioeconomic information from the US Census and intersected these water system service boundaries with census geographies. In this study, I happened to use zip code tabulation areas for the census geography and simply calculated the portion of these zip code tabulation areas that were intersected with the water system service area. And then I used weighting to say, how much should that intersected area of the zip code come into the calculation of demographic information at the level of the community water system. And so this is the general approach for calculating water system level demographics. Other features of this study were that the study was limited to water systems that reported to the EPA in the year 2000 or before, and also limited the sample to those systems that serve over 200 service connections or more. Below this size, we get into really small water systems, and reporting of violations becomes less reliable. That's documented by the EPA. And also estimating demographics using this approach of aerial interpolation is less robust for these very small systems. But nonetheless, even with these inclusion criteria, I'm including 1,700 water systems in California, and this represents over 99% of the community water system service population statewide. So these are some features of the study. And so, beyond creating this unique data set, how was this relationship assessed between violations and demographic factors? Well, for this, I developed a logistic regression model. And this is testing whether systems serving communities of color and systems serving communities of low income are more likely to incur violations. And so I modeled the likelihood that health-based violation occurs as a function of demographics and made sure to control for a variety of other system characteristics, such as source water, since this will also influence violation occurrence. So whether or not a system is relying on surface water versus groundwater versus purchased water, controlling for system size. That's obviously a huge factor when it comes to ability to comply. Ownership, public versus private. Also is controlling for population density, right? Urban versus rural, we know this matters for compliance. Also included a lagged violation indicator, since this is controlling for the fact that non-compliant systems tend to have reoccurring violations, and also made sure to control for fixed effects, year fixed effects. To control for the fact that regulations can change over time, or there's other factors that are time varying as well. So trying to capture these. Beyond this base model, right? Beyond the base logistic regression model that was developed, I also developed a set of subsequent models that were stratified by system size. And these were developed in order to assess if the association between violations and demographics is stronger among smaller systems versus larger systems. Because again, scale factors are well acknowledged by regulators, right? There's sort of this general consensus that smaller systems are going to have lesser capacity to comply with regulations versus larger systems. So I really wanted to see how these relationships between demographics and violations played out when I was stratifying by system size. And so this is an additional way to determine if factors beyond system size truly do influence compliance. So let's go to some of the summary statistics, and then we can ultimately go to some of the regression results. So what did we find after crunching through all these new data? Well, let's first go to a general overview in terms of what's happening in terms of non-compliance across the study period. And so this is actually highlighting some good news in California. So the good news in California is that after 2015, there have been notable declines in violations of health-based drinking water standards. And this just so happens to coincide with state-level efforts to ensure the human right to water, including the state water board's ability to force consolidation. This came in 2015. So although this study, right, is not testing the link between new policies in California and violations, this is highlighting that this might have a high potential for future research, right, to assess some of these policy interventions. And so we note this notable decline in violations after the year 2015. So that's some good news. This map is showing what's happening spatially in terms of health-based violations across the study period. And so, right, we're seeing that there might be more prevalent problems in the Central Valley. That's probably not all that surprising, given past work that's been done highlighting issues that are especially prevalent in the Central Valley. These are well-known concerns. And let's think about, so, we've gone through these general overviews, but what might be happening in terms of disparities, right? Disparities across income, disparities across race. Well, let's start looking at potential disparities across income. And here's where potentially, bad news might be highlighted in the state of California. So while some compliance gaps have narrowed, others have not. Others persist. And so gaps among those communities that are designated as severely disadvantaged communities, so those communities that have 60% of the statewide median household income level or less, these communities, if we look at the percent of systems that are designated as severely disadvantaged communities, and if we look at the portion of water systems that are out of compliance compared to everybody else, all other water systems that would not be designated as severely disadvantaged, we notice that there's a higher proportion of SDOC communities that are out of compliance versus everybody else. And even if we go right all the way to the end of the study period, we find that in the year 2018, almost 13% of severely disadvantaged communities are out of compliance with health-based standards compared to about 2% of all other systems. And so that's over a 10 percentage point compliance gap. And this gap is mostly due to arsenic, but also nitrate. Nitrate compliance has worsened for severely disadvantaged communities since 2011, but not for other systems that aren't designated as severely disadvantaged. So these are some factors, right, when we're thinking about disparities by income in terms of non-compliance with health-based drinking water standards. So overall, right, systems serving low-income areas appear to have incurred violations at rates several times higher than other systems. So this is, right, just summary statistics, disparities by income. Now let's take a look by race and ethnicity. And so again, right, there seem to be gaps in compliance, and disparities for systems serving African-American communities seem to have been, well, maybe smaller, right, than the severely disadvantaged community compliance gap, but it still appears to be persistent over time. We haven't quite closed the gap. And so in 2018, there still is a 3.4 percentage point difference between those water systems that serve African-American communities versus all other systems. And there's a similar, right, gap in compliance in the year 2018 for those water systems serving Latino communities. So some summary statistics to get us started. But now let's go to the regression results, right? The regression results from the logistic regressions that were developed. And so these are the results for the base models that were modeling the likelihood of violation as a function of demographics and controlling for other system characteristics. And what are the main takeaways here? Well, one model is modeling what's happening across all years in the study period. And the second model is taking a look at what's happening in most recent years only. And so what are the main takeaways when it comes to how various demographic factors are correlated with non-compliance? Well, when it comes to income, it seems that across all years, there is this significant association between disadvantaged communities and all others. So there's this link between disadvantaged communities and having a higher likelihood of incurring a health-based violation. However, the good news is that this association goes away in more recent years. Now, the association between severely disadvantaged communities, which was run in a separate regression, that association still remains. So perhaps this appears to justify California's growing focus on severely disadvantaged communities and prioritizing those communities for assistance. So that seems to be right, some justification for current statewide policy. But other demographic factors, the association remains between them and health-based violations. So if we take a look at what's happening in terms of Latino serving systems or African-American serving systems, the association for these, it doesn't go away in more recent years, although the magnitude does decrease, which might be some good news. The overall significance level remains. So there appears, still work to be done in terms of addressing these potential inequities when it comes to drinking water quality across the state of California. Let's see. And so what are some other results that come out of this? So this is just the base model results. If we take a look at then, right, those subsequent models, those alternative models that were stratified by system scale, by system size, this further highlights the importance of income, race, and ethnicity in explaining non-compliance. These results indicate that among smaller systems, there is a strong association among income and non-compliance, as well as race and ethnicity and non-compliance. But for some factors, these associations go away when we move to large systems. So we seem to break the link between disadvantaged communities and non-compliance as we move to larger systems that have, greater economies of scale and perhaps a greater capacity to comply. It also seems that there's, as we move to those larger systems, the association between Latino serving communities and non-compliance also goes away. But one link that does not go away, there seems to be persistent disparities regardless of system size for African American serving communities. There are persistent large disparities when it comes to these communities that perhaps deserve a closer look, and perhaps further research could be done in regards to these gaps. So to sort of again highlight these differences, stratifying the results by scale and taking a look what's happening here. This is a way to visualize, right, the regression results that you just saw stratified by system scale. And again, this is highlighting how for some factors like income and Latino serving communities, the compliance gaps greatly reduce as we move from small systems and go to larger systems. But persistent disparities still exist for African American serving communities, regardless of system scale. It even appears that there might be larger gaps experienced by large systems that serve African American communities. And so again, this sort of highlights that conventionally, a lot of targeting tends to occur for directing resources to smaller communities, potentially, right, smaller disadvantaged communities, and certainly these communities are in need of targeted assistance. But what this might overlook are larger systems that serve communities of color that also might be in need of greater assistance in terms of bringing them into compliance with health-based drinking water standards. So some takeaways that emerge from this study is that, overall, this is providing greater context for at-risk communities. And it's really showing how disparities have evolved over the past 20 years in California. And hopefully this can help inform efforts to target communities for assistance. This study finds evidence of water equity concerns for low-income areas and also communities of color. And systems serving these communities have incurred violations at rates several times higher than other systems. And this is demonstrating the influence of income, race, and ethnicity on the capacity of water systems to comply with safe drinking water standards. And so this is highlighting the need for environmental rulemaking to consider factors beyond system scale and assessments of ability to comply. And a focus on smaller utilities might overlook issues faced by larger yet under-resourced systems, especially, right, those serving African-American populations. And at a minimum, including income levels in assessments of compliance capacity could improve equity in rulemaking. And with that, I will close out here, and I'm certainly looking forward to discussing and hearing your questions.
Thank you so much, Maura. So there were a couple of questions in the chat, but also some other folks maybe answering some of those questions. So I don't know, Colleen, you had some clarifying questions. Do you want to start with that and get that resolved from earlier? You're welcome to just unmute and go ahead and ask, Colleen. Oh, okay, no worries. I will ask for you. So I think, so one question was about including for the alternative sources in the regression analysis, if you were including groundwater.
Okay, sure. So I was considering 3 sources. So I was considering groundwater, surface water, and purchased water. And groundwater was my omitted category. It was my comparison category. And so the variables that entered, right, the regression are surface water and purchased water, but those results should be interpreted in comparison to the groundwater systems.
Great, thank you. And the purchased water, there was also a clarifying question about that, and that is like surface water, right? That's coming in from outside the district?
Okay, yeah, so good question. So the way that EPA defines these source water are if a system is a surface water system, then that is any system that receives even a little bit of surface water. So that's the EPA definition. Purchased water, I forget what threshold systems have to cross, but this is water being purchased from a wholesaler. So if you're purchasing water from another system, you would be considered a purchased water system, but you have to cross some threshold in order to be considered that. And groundwater systems, by and large, are relying on their own wells for pumping groundwater.
I'm also like, I had a question about just like trying to understand like the cause of the violations, so I could better think about the disparities. And you know, when you're separating it out with small systems and large systems, like I really understand this sort of like, or like I can think about economies of scale and how that might affect violations. But so but within small systems or within large systems, like what's driving the violations, and like sort of why I'm asking, because in part because I'm trying to like think about the results you showed about you know, disproportionately large African-American communities having more violations in small and large systems, and trying to understand, you know, why that is. And so would you be able to elaborate a bit more just in general of like what's causing the violations?
Sure. So all of these are health-based violations. And so what these mean are these are largely limited to maximum contaminant level violations for the 91 contaminants that are regulated under the Safe Drinking Water Act. Mm-hmm. And so what this means is that based on the sampling record, the state regulator, in this case, right, we're limited to California. So the State Water Board has determined that based on the water quality sampling record, that these systems have exceeded, right, regulatory levels of the 91 contaminants that are currently regulated. So what this would require, right, is water systems to go out and take their samples. And it also requires regulators to make the right violation determination. It is true that about 25% to 33% of situations that should be reported violations or designated violations based on the sampling record aren't ever recorded as such. And now that's the national average. I've dug into the sampling record in California, and California does a bit better than that. But these are some of the hurdles going from, what's actually happening with water quality at a particular water system to actually declaring, right, that regulatory violation.
Mhm.
Good question there. Any, did that clarify things?
Well,
or
can I follow up more? I mean, I guess I feel like there are reasons why you might have violations based off of like changes in the water quality. And then there's also the other element of like, whether or not you're looking for changes in water, and are you sampling enough to have a violation? And I guess, yeah, I don't know enough about what drives the changes in water quality that would create violations if you had equal sampling and testing across all the
right. And so
systems.
and so certainly, right, sampling requirements vary based on the contaminant being sampled. They also vary across system size. The logic there is that right, larger systems would have more facilities and more miles of distribution networks to have to test. So there is some variation there. And then the EPA does do, right, graduated regulation, which means as soon as a potential problem is caught, then more frequent sampling is required. And so there can be, almost a spiral for utilities that, if there's a little issue being caught, then this could potentially reveal more serious concerns. So if you're doing well, if you have a good track record, you get to sample less frequently. If you don't have a great track record, then you have to sample more frequently. These are some other considerations.
Does that explain partly of when you showed the national map and like concentration, like in Oklahoma, could that be part of an explanation for that?
Oklahoma is an I guess it could to some extent. Oklahoma is an interesting case where the regulators themselves, this is largely in Oklahoma, a big component of this are those disinfection byproducts. And at least up until 2 or 3 years ago, state regulators in Oklahoma were actively trying to reduce requirements of the stage 1 and stage 2 disinfection byproduct rules. So I think you have a situation where, right, there might be some disagreement between state regulators and federal regulators in terms of what the rules should even be in the first place.
Great, thank you. Other questions? Yeah, go ahead, Max. And if others want to type theirs in the chat, I'm happy to ask them on your behalf tomorrow. But go ahead, Max.
I was just interested in the kind of temporal autocorrelation thing over time. Did you, looking at the data, did you see any kind of signs of that, and in which areas, and what were the reason for those, if you saw those kind of clustering over time that kind of got dragged along?
Sure, good question. So I did in my previous national assessment, I really dove into those. California in particular, I would have to get back to you because I didn't dive into the issue of reoccurring violations to the extent that I did in the previous national study. It's a good question, and that is certainly something that would be important.
So what was the national? What did you find in the national?
So in the national, it was really interesting because overall there is considerable compliance with national standards, right? And it's only these 7 to 8% of water utilities in a given year that are non-compliant. And then among those, right, there seems to be a small portion of utilities that just year after year are not complying with certain contaminants. So it isn't the case that, a given water system would be out of compliance with all 91 contaminants that are regulated, but certain utilities have specific contaminants that just pose a specific concern. And it can be a combination of the source water that they face and the treatment technology that they have available to be able to, clean that, clean the source water up. So it was interesting that there was, a relatively small portion of water systems that just year after year had real trouble complying.
That's really interesting. I just needed to another build up, but it's really interesting from a perspective of there could be isolated people that actually are doing this and things like that. You could really expand it into street level by bureaucracy theory really easily. It could be really, good job.
Potentially. Okay, thank you for your comments.
So there's a question in the chat from Anna Grace, asks, what would you expect the results to look like if you included the less than 200 and smaller unincorporated communities?
Okay, yeah, so it was only those less than 200. I don't know if I could speculate about that. So the real holdup with this, is that water systems themselves are not tasked with collecting demographics about their customers, This isn't required by regulators. So neither regulators are collecting it nor water systems. And so what I was doing is relying on aerial interpolation. And, if you're getting down to these tiny, tiny systems, it's really hard to approximate the demographics of customers there. So I would have to say, I don't know. But I would also say, although these systems serving 200 connections or less weren't included in the study, they serve a relatively small portion of the California state population that's served by a community water system, Less than 0.8% of the state population relying on a community water system is being served by these very small systems. So I would have to say, I don't know. I don't know how that would play out. Depending what these systems look like. A lot of times what these really small systems look like are small homeowner associations. A lot of times some of them can be mobile home parks. And so ultimately I would have to say, I don't know. So the results are generalizable to those systems serving over 200 connections or more. And that captures the vast majority of the state population. But yeah, addressing those super small systems, I'd have to say that would be an excellent question for future research. But there would probably need to be another approach, to calculating demographics. You might have to do, a more regional study and somehow collect the demographics on your own. So yeah, good question there.
Can I see your marginal effects table again? Do you mind?
Oh, sure.
Over to the side. And Safik asks, I guess I was thinking the slide that had, it's like you showed it graphically.
Okay. This one?
Yeah.
Okay.
Okay, so Safik asks, did you find any link between drought and non-compliance, especially in severely disadvantaged communities and underserved communities? Curious if these communities are impacted more by drought than larger systems, for example.
Okay, drought periods? I didn't see that. So that would be, I didn't address, I didn't address that question, but I think that is, great brainstorming for future research. So I wasn't assessing the links between, any sort of climate impacts. The only thing I might have been doing was, throwing in a time fixed effect, for each and every year. So I think good question, and I don't think this study does not address that particular question, but that would be interesting to look at. And I think especially if we think about recent drought events in California that were pretty much felt statewide, you would probably have to develop, right, some sort of natural experiment that you're bringing in a separate state to look at, to better look at that. So I think that would be an interesting natural experiment to potentially set up for future work. So thanks for thinking through that.
Yeah, I noticed that over time, those disparities, the gap, increases, and I was just curious whether they coincide with the drought periods.
Yes, there's a lot of things that coincides with, right? I mean, it's drought, it's just the whole statewide approach to trying to fulfill the human right to water. I think there were a lot of activities happening here. And I think, a research design that, brought in another state beyond just California to actually look at that and address it empirically, that could be really interesting to get at the why. Because right now, the summary statistics are just saying this happened, but I'm not addressing why it might have happened.
Got it, thanks.
So there's another question in the chat from Sam. He asks, if you look at the map of California that has the violations, he's wondering if, one, the number of violations are related to the water sources, which in turn are related to redlining policies. And B, if communities that are located in places where they could only afford to live, and it's those communities are located near places where known water contamination is occurring.
So I think, those are all good points. There is a slight correlation between African American communities and those locations in the state that are known for elevated levels of arsenic in groundwater. And arsenic violations was one type of violation that systems serving African American communities were potentially facing. So although this study didn't address the quality of source water, certainly future research could. And so, this is raising, this question, sort of the classic environmental justice question are, folks, moving to the hazard, or is the hazard developing around them? And I think, for drinking water, the answer might not be quite clear because, I mean, you do have, this combination of the source water that a particular community is relying on, but then, it's being treated by a water system. And so the capacity of the water system to treat their source water is certainly going to come into play here too. But I think source water is something that, future work could do a better job of addressing. So thanks, Sam, for all those thoughts there. And certainly,
and
the affordability. Okay, there's another. Was there follow-up?
Oh, I just didn't, if Sam had follow-ups to your response, I just want to make sure he felt welcome to unmute.
No, I think, I mean, it is, I mean, it might be very difficult to kind of do it from here, but it's kind of a thinking out loud of, if this is occurring because land use policies were set in a way that put them in that place, and then all of a sudden, this place only has this source of water that we know is contaminated or not. Mm-hmm. The other one is
continue.
No, the affordability. I mean, so when they got into a violation, I assume that EPA will have to say like, okay, you need to get your act going. So you need to improve these systems to tertiary and so on. So it is more money spent to the drinking water that ultimately is passed to the customer, which is a DAC. Is this happening? Have you thought about this, or have you done any exercise on this?
Yeah, so I mean, I haven't addressed it specifically in this study, but I think, this highlights how limited current practices are for regulatory assessment of affordability at the EPA, because when EPA is in its rulemaking process, they're trying to figure out, are new rules affordable for communities? And their current standard for determining whether it's affordable are whether customers' water bills are going to rise above, I think the current metric is 2.5% of national household income, but they're not considering the income levels of specific communities, which would seem important to truly understand if communities in a specific area could actually afford compliance. And if they can't afford compliance, what could be done in terms of targeting and assistance to help them meet national standards. So I think the issue of affordability has been drastically under addressed for Safe Drinking Water Act. For Clean Water Act, there have actually been, just this year, there have been major advances in terms of how affordability is assessed there. And so hopefully similar updates could be made on the Safe Drinking Water Act side too. And I think your comments about communities locating in areas that they could afford to live, how does this influence exposure? I've seen preliminary work by actually some PhD students at UC Irvine, and they were just trying to do a hedonic study of housing prices and drinking water quality. And at least in their initial findings, they're not finding a clear link. And I think a major reason why this might be the case is that folks often have imperfect information about what their drinking water quality is. Certainly their drinking water quality in the current location that they live, let alone, drinking water quality of a potentially, new apartment or new house that they're thinking of going to, right? This information, isn't widely available. There are annual consumer confidence reports, and these are fairly accessible for larger water systems that serve over 10,000 people. But as you get to smaller and smaller systems, I believe it's, once you cross the threshold of like serving under 3,300, I think water systems simply have to make it available on request. They don't have to send it to individual customers at that point. So I think, this issue of being informed of your drinking water quality, I think that's a huge issue. And folks might not be aware of the water quality where they're currently at, let alone places they're thinking about moving to.
Thanks, Maura. Excellent work.
Quick question from Hope Hoffman in the chat, asking if you looked at nitrate violations specifically.
Okay, sure. So, I didn't zero in on any one particular violation. I was looking at them all together, but, I was trying to dig into, right, when I was seeing that there were compliance gaps, what was happening. And actually, I'll go to this one. So by and large, what I saw across the state was, arsenic was sort of, the main culprit in terms of explaining these compliance gaps. But for severely disadvantaged communities, and I think a few of the other demographic groups too, there was this, and it would be great to hear, anyone from the audience, what your thoughts are. There was this increase in nitrate violations for severely disadvantaged communities that happened after the year 2011 that didn't happen for communities that were that had higher incomes. So this was explaining some of the gap, especially after year 2011. So if anyone has thoughts out there of what was happening after 2011 with nitrate in California, especially nitrate in lower income communities as opposed to everybody else, I would be really curious to hear your thoughts on that. So, arsenic was a big culprit and nitrate to a lesser extent, but there was a disparity, especially after 2011.
Great, thank you. In our last couple of minutes, there's one more question that is something I was also curious about when you're presenting. Like on this slide in particular, you see like after the policy around consolidation, you're seeing this big drop. And so Colleen's asking or saying, I've heard that there's been a struggle to consolidate utilities, though it seems from the graph that it may have helped reduce violations. So have you observed a lot of utilities consolidating?
So yeah, I mean, at least based on what the state water boards have posted, there haven't been a lot of consolidations that have actually occurred. Again, an actual empirical study would have to be done to explain the why of this. But another potential explanation that could be tested is that, maybe it's not the actual physical consolidations happening that might be improving compliance, but maybe now, that there's this threat of consolidation if systems are not meeting national standards, maybe that threat plays a role as well. So sort of having that stick might help. But again, this is speculation, would actually have to be tested with an empirical analysis. But I think, one could easily be set up, especially if you're going to bring in, another state and sort of, maybe have a different diff or something like this to compare what's happening in California that actually had these interesting policy changes versus states that didn't.
Great. Well, thank you so much, Maura, for sharing your work. It was super interesting. I learned a lot from it. So yeah, let's all thank Maura for joining us today. And thank you all so much for coming and sharing your Friday afternoon.
And yeah, thanks so much for everyone for attending, and yeah, the interesting discussion and questions.
Yeah, thank you, Maura. Take care, everyone.
All right, take care.
Thank